Dr. Stan Yeatts, an OB-GYN physician for over 30 years. I've delivered more than 4,000 babies. I've noticed that many pregnant women experience some form of spotting during early pregnancy. I understand the anxiety that comes with seeing any unusual discharge during pregnancy. During pregnancy, your body goes through remarkable changes. You might notice various types of discharge: clear, white, and yes, sometimes pink. This pink tinge can appear at different stages of pregnancy, from those earliest weeks to the final trimester. The appearance or color of the discharge can suggest something is happening. The pink color typically comes from a small amount of blood mixing with mucus. There are different reasons for signs of blood as the pregnancy progresses. At the beginning of pregnancy, the fertilized egg reaches the endometrial cavity of the uterus. This process is called implantation and occurs between 6 to 10 days after ovulation. A small amount of pink discharge may be seen as the fertilized egg is established in your uterine lining. Each woman's body is unique, and the hormonal fluctuations can cause variations of discharge. As a general rule of thumb, estrogen levels are high throughout pregnancy. Increased estrogen causes increased circulation and blood supply to the mother's tissue. The increases in vascularity is important to support the pregnancy and provide nutrition and oxygen for the baby. A side effect of this estrogen is that the mucosal tissues are also swelling with the extra blood. This normal physiological change may result in symptoms as nosebleeds or bleeding gums when you brush your teeth. The cervical changes can cause slight bleeding after activities like a pelvic exam at your prenatal visit, sexual intercourse, or even intense exercise. Another reason for pink discharge is in the case of potential miscarriage. In this case, it's often accompanied by other symptoms like cramping, heavier bleeding. If you experience any of these symptoms, please seek medical evaluation immediately. I've cared for many patients who've had bleeding like this and needed to be reassured with evaluation by a medical professional. The only way to know what's going on is to have that assessment from your pregnancy care provider. It's essential to monitor any changes and consult your healthcare provider if you notice blood, severe cramping, or one-sided pain. A pink discharge may be observed in later pregnancy for different reasons. In the last month of pregnancy, the cervix is getting softer in preparation for the dilation with labor. Sometimes women may observe what's called a bloody show. Blood mixed with mucus can spontaneously show up on your underwear. Pink or bloody discharge may also be observed immediately after a pelvic exam at the end of pregnancy. These exams are performed to document any changes in the cervix and confirm that the baby is in the appropriate position for labor. As the exam is performed, it may stir up more signs of blood. In these cases, the pink discharge is considered normal and part of the process. They say that knowledge is power. I want my patients to be informed about their situation to prevent any unnecessary fear or anxiety. If you experience unusual discharge, they say that knowledge is power. I want my patients to be informed about their situation to prevent unnecessary fear or anxiety. If you experience unusual discharge with pregnancy, here are some characteristics that you may want to document to share with your pregnancy care provider. Color, the amount, the duration or frequency, and any associated symptoms. This information will help your provider diagnose the situation for your benefit. Let me remind you of lifestyle basics to help you in pregnancy. Stay hydrated by drinking plenty of water. Eat a balanced diet rich in essential nutrients. Avoid smoking and secondhand smoke. Limit your caffeine intake. Get regular prenatal checkups to monitor your baby's development. By taking these simple steps, you can minimize the risks of complications and stay healthy throughout your pregnancy. Many expectant mothers are curious about how to prevent discharge or minimize irritation. Some discharge is a normal part of pregnancy, while others may be improved with these simple steps. Wear breathable underwear made from natural fibers like cotton. Avoid using harsh laundry detergents that can damage fabrics. A panty liner is temporarily acceptable, but may cause skin irritation or even a fungal rash if you wear a panty liner too often. If skin seems irritated, avoid using very hot baths, which can aggravate skin inflammation. Here are some practical steps if you experience frequent discharge. Keep on schedule with all of your prenatal appointments. Report any significant change or unusual symptoms that you don't understand. Start a pregnancy journal. If you're frequently observing symptoms, you should get feedback from your pregnancy care team. Follow your instincts. Consider using resources to stay informed, such as the Stork Advisor website and app. New content is being added to support women before, during, and after pregnancy. Be prepared for any surprise symptoms with clean underwear, panty liners, etc. Make sure that you have that contact information for your pregnancy care team, especially after clinic hours. Inclusion. Pink discharge during pregnancy is a common phenomenon that affects many women. Understanding what it means and how to manage it will help you in your pregnancy journey. It may have different causes at various times during pregnancy. If you sense that something is not right, don't hesitate to reach out to your pregnancy care team. Your pregnancy care team is there to support you. Stay informed, stay proactive, and don't hesitate to reach out to them with any questions or concerns you may have. For more detailed information, visit our website at storkadvisor.com, where you'll find more women's health information. This is Dr. Stan. Thank you for joining me today. Stay healthy, stay informed, and I'll see you in the next video.